Hello, welcome to MRO's last session of the day. We are so excited to be joined by the Minnesota HIM chapter. We're going to talk about building coalitions and advocating at the state level. I'm joined by Nathe from the Minnesota chapter and Adrienne Morrell from MRO. I'm Lori Long, also with MRO. So we'll get started with just a little bit more introduction about each of us, and then we're going to run through our top 10 list for advocating at the state level.
Awesome. Thank you, Lori. I appreciate that. Welcome, everybody. My name is Nathe, and I'm currently the Executive Director for the state of Minnesota and for the state of Georgia. And I know that they don't touch on the borders, but we touch each other a lot. We'll put it that way. So previously, I've worked in a variety of healthcare settings. I've worked in critical access facilities, acute care facilities. I actually owned and operated a medical supply store and a pharmacy, building them from scratch, still maintaining my pharmacy tech certification. I've been involved in advocacy for well over 15 years here, attending that state and national Hill Days, being involved in the legislative information. I'm also a past chair of the AHIMA Advocacy Council, and so I am just proud to be here today, and I hope you enjoy our session. Thank you.
Thanks, Sue. I'm Adrienne Morrell, Vice President of Government Affairs for MRO, and I handle state and federal government affairs. I've been in health policy advocacy roles for over 25 years, health IT, payer side, providers, pharmaceuticals, and began my career on Capitol Hill, working for a U.S. Senator and a U.S. member of the House of Representatives. Lori?
My name's Lori Long. I'm Senior Director of Public Policy and Government Affairs for MRO. Like Adrienne, I started my career working for a member of the United States Senate and quickly transitioned into the state world, where I worked in my local state capital staffing committees. I worked for a governor, an insurance commissioner, and then found my way into corporate government affairs. I've been working in and around public policy and state and federal government affairs for healthcare for 30 years now. I'm really excited to be here today talking to you on behalf of MRO. So we're going to go through our top 10 list when advocating on state issues, kind of walk you through what all the components of state advocacy are, and sort of share some insights and examples of how we've collaborated at the state level, in particular in Minnesota, but some other experiences we've had across states. We're also happy to take questions, so please feel free to raise your hand, and you don't need to wait to the end. So number one, ladies, relationships, knowing who to engage and when. Thoughts on where we begin?
Well, first and foremost, you have to know if you have an issue that you're going to need to address. And that's really the big challenge. You may get that information from a variety of areas. If you are lucky enough to work in a large healthcare system, you may have a legislative team. But, coming from outstate Minnesota, working in the small rural facilities, I might find out about an issue through newspaper. I may have read it through the information on the website for the legislative sessions. Or, I may have just someone who may have heard something that brings it to your attention. But you want to make sure that you have a resource that can get you information and stay involved. For myself, I have a good friend who does work at a large healthcare facility in our state, and they provide information to me because I was an individual who managed our advocacy team at the state level. That information flowed directly to myself.
Yeah, good point. Information is key, Sue, exactly. And I think from a MRO perspective, Lori and I do government affairs full time, so it's our job to obviously monitor what's going on at the federal and state level. We've got tracking systems. We have lobbyists on the ground in some of our states, but not all. So it's really, finding out information and relationships with policymakers, just to ensure we know, sort of what's the pulse that legislators are working on that coming session, what issues are hot, sort of being in the know.
Wouldn't you say, ladies, that timing is also important? So in the ideal situation, we would know during a legislative interim. So in those months rolling up to when your state legislature is convening, you might begin to hear that there's either a bill that might be introduced or a constituent concern of a member of the legislature. And then that gives you time to sort of build a plan, right?
Oh, I agree, absolutely. The problem is time is always short for everyone, especially when it comes to legislative information. But if you're aware that there's something pending that's going to be coming up, we were discussing early even, the plan here is to be proactive versus reactive. You're going to get a much better response when it comes to something like that. And I would encourage each and every one of you to go out and look at your legislative websites for your states. I did have the opportunity to tell the story of the challenges and the effects of this bill and how it would really create issues across our healthcare consortium. So I was able to testify before the Senate. I practiced immensely, I will tell you, because they tell you have 2 minutes to get your point across, and that's it. And so I spent a significant amount of time. But we worked together, all of us, to come up with the story of how it's going to affect everyone, the challenges related to that. One of the things in our message that we wanted to make sure, and was shared by our lobbyists, is that this story didn't or shouldn't it necessarily come from a vendor standpoint. They felt that if it did, that the outlook would be as well, they're just worried about making money. And that wasn't what the issue was at all. It was truly how this was going to affect the livelihood of many of our healthcare organizations, because we make money making copies of records. It's, not a high amount of money that we were making, but in all honesty, I had 2 staff that was their full-time job in ROI, making records. And now we were looking at the possibility that now it's going to be a completely different process. And not only am I going to lose staff, but I'm going to affect potential health care for my patients because I may not be able to get that information timely. That's a real challenge. And so we wanted to make sure that we got that point and that message across to the legislatures for them to understand the complexity of what they were looking at doing.
You're exactly right, Sue. I mean, this was all about patient privacy and being able to fulfill, that fulfillment of records. And so, Sue, hats off to you for doing such a great job testifying. She did a fabulous job in her testimony, and I know it's not easy having to do that and do it in a 2-minute time frame, but you did a great job.
Thank you.
In addition to testimony, messaging is so important with the collateral that you develop as a coalition. So these are, one-page documents explaining your position on the bill and sharing important information about patient privacy and sharing those across the coalition. I felt like was very important too. We all were sharing the same talking points and the same collateral in our legislative meetings.
And letters.
Yeah.
I mean, every organization wrote letters in response to the bill. So their positioning, I think that is really important for not only legislators to hear our position, but also for records, right? We talked about that history, right? So that would all be in the hearing record on your position, support or oppose. And in this case, it was oppose. But now those are all in the record for when this issue comes up again.
Yeah, absolutely.
Engagement. Knowing who to engage on the ground, what kind of lobbyists, who would be best to engage, prepping messengers to participate in key meetings.
I'll start. I mean, again, talking about some of our states and Minnesota in particular, I'll talk about our lobbyists that we engage. We are really lucky to have a strong team in Minnesota, and in that we actually had 2 former members from both parties who represented our coalition. And so we're a wealth of information and history, as we've said, and also, knew what it was like to sit in a legislator's seat and, hear an advocacy pitch and the impact it had. So they were really helpful, not only in, Sue's testimony, but our collateral messaging and our strategy.
And knowing the timing to engage, right? So, you've got to do some early engagement to get your message out there. But as the proposal is moving its way through the process, there are key moments that your lobbyists can help collaborate with the coalition and with entities in the coalition on this is the time to get your messages to members because they're considering the issue prior to committee, prior to floor session. Timing's really important.
Absolutely, and their relationships as well. It was extremely beneficial to see that, the individuals that we were working with had relationships with current legislators, and they were able to, either with them or their staff, that we were able to utilize that information to really know when we were able to engage specifically with that information, those key components of it. And that led to ensuring that we were prepping them for that in those meetings so that we could get that information. So like the letters and information, we're hitting the desks, hitting the folders to those people at that prime time.
Grassroots, our favorite topic to talk about. Knowing how to leverage your grassroots, which I have to say, Sue, I've seen a lot of grassroots in my career, and the collateral you put together in Minnesota, bar none, incredible. And share with us the method to your madness. Like, how do you make these incredible pieces, and how do you get your members to know what to do when the grassroots call to action goes out?
Well, I think first and foremost, you have to have an advocacy team. You have to have people who are knowledgeable about that information. But you have to make sure that you get to the right people at the right time. I'm lucky enough as the executive director that I have access to the information we get from AHIMA. So I have the member database that I can get to. Utilization of appropriate software. I utilize an email communication software that I can do mass emails out quickly in a timely manner. That was really key components. I couldn't wait for a third-party entity to put out an email for me. It had to be done immediately. But identifying, as we said before, who's going to be the face of that specific item that you're going to deal with, but getting to the individuals, ensuring they have the resources to do the job that needs to be done. The other thing that we talked about earlier a little about is ensuring you provide the communication to your members, to the people who need to have those discussions with your officials. You want to make sure it's clear and concise. You don't want to have them walking in an office, well, I was told I have to come see you, but I really don't know why. You have to know what the ask is and provide that for them. So I would really encourage any of you who are looking at that. Direct, concise communication is the key to the appropriate people in a timely manner. Be very concise in regards to turnaround time, dates of high component areas, when is this going to hit the floor? Make sure people understand the need and the importance of it.
Yeah. And MRO, we engage our employees on bills too. And it's really about making it simple. They understand the issue. They then can find their, an easy way to find their legislator. So they're connecting with their right, policymaker, and making it, a click of a button that they can distribute that and can get in front of the legislator quickly.
It sounds silly, but just explaining how to find the information on the website. This is how you email your legislator. Here's an example of a message you could send. And please send it by this time. Sometimes those messages go out late, and Adrienne, I have to say, at MRO, we're so grateful for the marketing department for getting those messages out fast to our employees, sometimes late on a Friday. And it's still exciting to see when we've got engagement, either from our AHIMA members or from employees from vendors like MRO.
Yeah, I'd also say from the state side, make sure that you have that ongoing, consistent communication. We do an ongoing e-blast so our members know what type of information they're going to get and when. So, if there's a special alert that goes out, they're going to be aware of that. So that consistency is huge.
Yeah, the grassroots call of action should not be the first time you're communicating.
Think about it this way. The grassroots call of action is going out right before a vote, right? Either in committee or on the floor of a legislative body. And so you're really trying to get folks to take action and express their position on the bill to help influence the outcome.
Yeah.
Follow up. Knowing the best avenue to follow up, there's so many different stakeholders to continue the conversation with, right?
Yes.
Whether it's the legislators themselves, your coalition members, your lobbyists. Follow-up's so key.
Oh, absolutely. This is not a one and done.
Yeah.
You have to ensure that you're staying on top of this, staying in contact, that your legislators know who you are. We've talked about even in session, but out of session. Right. If you have that opportunity, maintain that communication with them. The better your relationship, you're going to have a better chance to work with them on these necessary legislative items. So make sure that you continue to have that. Make sure that you keep your members engaged so that they understand this is what we did, this is our process now, where we're at, and the follow through or follow up that you may have to continue to work on. As we said, this is not going to be done in a short amount of time.
No.
If your legislature is a 2-year timeline, you need to continue to work on that for 2 years.
And beyond, potentially.
Yeah. Yes.
Yeah, you're so right.
Yeah. And continuation, knowing the real world examples and data, like how do we keep the ongoing education going? Say you had a bill come up in your legislative session, whether it was 1 or 2 years, it wasn't a great bill. You defeated the bill, let's just say optimistically. But you know that the proponents are going to bring it back the next legislative session. How do you use those lessons learned to make sure you've got the right information and data to hit the ground running the next time this comes up?
Well, first and foremost, it's making sure you maintain those archives of that data information that you've created. You want to make sure that you are prepared to come back and repeat the information that's been done. As I said, with the copy fee issue that we had and the record retention issue, we had 3 surveys done over the course time of 5 years to make sure that we could have accurate, up-to-date information. But you want to make sure that you have a place you can keep that, and you want to make sure you have someone experienced that understands, again, that history that can speak to it appropriately. Advocacy is not just one session and again you're done. The more information you have, the better you are at explaining the processes and the concerns that you have related to any potential issues.
Yeah, and I would say what's key, if you've built those champions, right, from a legislator perspective, hopefully if they're your champion and they're still in office, right, it's having them then help, with that continuation of messaging and helping to promote, what's the impact and what would be the consequences, both proactively and reactively. But
take that time in between session to deepen
Yeah.
your relationships with those champions.
yeah, do you have time to do a study
Yeah.
to show an impact study? That's often what we use, sort of the non-legislative year or downtime in a session, so we're ready again for the next session.
Absolutely. Just remember, those people that are out there advocating, they have the passion for that. Don't let that passion die. Keep them involved. That's the big thing, really.
Right. Okay. I think we were so thorough. Thank you.
Yeah,
Thanks, ladies.
we're happy to answer any questions.
We'll be around.